Welcome to the deep dive. We're tackling a topic today that, frankly, hits profoundly close to home for so many people: the state of NHS maternity services in England.
Mm.
We've all seen the headlines about the national investigation launched by Health Secretary Wes Streeting, but I'm really keen for us to sort of unearth how a system could get to this point, this really devastating point,
Mm.
and what it actually takes to mend it.
Yes.
And we've got our expert guide here with us to help navigate this complex, often quite heartbreaking landscape.
Absolutely. It's a critical issue, a really important conversation to be having. I'm ready to delve in.
Okay, great. So let's dig into this then. What exactly was the spark that ignited this national inquiry? And we're talking about systemic failures, tragic incidents. What brought us to this point, this absolutely necessary point?
Well, what's really striking here is that this inquiry isn't some sudden reaction. It's actually the result of, well, over 15 years of pretty severe shortcoming.
15 years. Wow.
Yes. And tragically, preventable deaths of mothers and babies. We've seen specific awful incidents at places like Shrewsbury and Telford, East Kent, and Nottingham.
Mm.
These failures, these terrible outcomes combined with ongoing problems really made this national investigation unavoidable. So the inquiry is now taking a hard look, a real microscope, to the 10 worst performing maternity units.
Okay.
Places like Leeds, Gloucester, Mid and South Essex, Sussex. Areas where we've seen worryingly high rates of avoidable harm. And I think connecting this to the bigger picture, the aim is to finally consolidate findings from all the previous reviews.
And I bring it all together.
Exactly, into one single unified national strategy. That's
Yeah.
the hope anyway.
It's just heartbreaking, isn't it, hearing about the human cost behind those statistics? Can you talk a bit about the personal testimonies? What is it about those stories that has really sort of galvanized the public and finally forced action?
Well, these aren't just sad stories, are they? They've really formed a kind of critical mass, almost like a collective roar that made it impossible for policymakers to just look away anymore.
Right.
Many women have come forward with truly harrowing accounts. Like former MP Theo Clark, she publicly shared the lifelong physical and psychological injuries she suffered during childbirth.
I remember reading about that. Terrible.
It is, but it's not just high-profile cases. It's the sheer volume of mothers describing feeling dismissed, unheard, sometimes actively harmed by the system meant to care for them. Their collective voices, their cries for change have created this undeniable force. It really proves that public demand can be pivotal.
So you have these individual tragedies, this collective outcry. It really paints a picture of systemic failure, doesn't it?
Mhm.
What are the fundamental cracks? What are the core issues in the system that allowed these problems to persist and even get worse?
Yeah, that really raises an important question about where the vulnerabilities lie.
Yeah.
And we can identify several factors, and they're all deeply interrelated, which makes it complex. So first, you've got persistent staffing shortages. A really stark decline in both midwives and obstetricians, which just strains the entire system, sometimes to breaking point.
Right. Not enough people.
Exactly. Then second, there are significant cultural challenges. There's been, in some places, a deeply ingrained culture that sometimes prioritized a specific ideology of, say, natural birth above necessary medical interventions. And that has led to tragic outcomes.
So culture plays a big part.
A huge part. And what's insightful is how these issues, staffing and culture, they don't just exist side by side. They often make each other worse. It creates this kind of vicious cycle of failure. And then, added to that, we have really concerning racial disparities. Black and Asian women face significantly higher risks during childbirth. That's a stark reality we have to confront.
That's shocking.
It is. And finally, there are clear accountability gaps. Failures in leadership, in oversight, that have just allowed these issues to fester for far too long. The National Maternity and Neonatal Task Force, that's specifically aiming to boost accountability and safety, trying to get greater intervention from the very top levels of the NHS.
Okay, so we've had inquiries before. You mentioned Ockenden, which looked into Shrewsbury and Telford. From your perspective, what's the single biggest reason those recommendations haven't always been consistently implemented across the board? Where's the real sticking point been?
You're absolutely right. The Ockenden review was crucial. It really laid bare not just individual failings, but what was described as a toxic culture at Shrewsbury and Telford.
Toxic culture,
Yeah, where concerns were just routinely ignored, and this relentless pursuit of natural birth targets led to devastating preventable harm. The biggest reason for inconsistent implementation, I'd argue it comes down to a lack of rigorous, sustained oversight and, frankly, adequate resource allocation across every single NHS trust.
Resources and follow-through.
Exactly. It's not enough just to make recommendations on paper. They need to be actively enforced with a clear budget, a clear timeline, and real consequences for inaction. So looking ahead, the key steps for meaningful improvement have to include better, consistent training for staff, proper funding and resources, a radical cultural shift that genuinely values patient voices and informed choices.
Listening to patients.
Absolutely. And crucially, targeted strategies to tackle those racial disparities we talked about. While the challenges are, well, they're monumental, the current momentum, this national focus, does provide a unique opportunity for real, lasting change. Cautious optimism, perhaps.
That brings us right to you, the listener, especially if you happen to be an expectant mother navigating the system right now. Given everything we've discussed, the complexities, what's the most practical advice you would offer?
Okay, yeah, that's vital. My advice is really threefold. First, stay informed. Really get to grips with your rights, understand all the available care options. Yeah. Knowledge is definitely your most powerful tool here.
You know your rights.
Second, speak up. Don't ever hesitate to voice your concerns or ask questions, even if you feel like you might be dismissed. Your voice is important. It has power. Insist on being heard.
Okay, speak up.
And third,
Seek support. Connect with advocacy groups, patient support organizations. They can offer invaluable guidance, practical help, and emotional support during what can be a really challenging time. Don't go it alone.
that's really practical, vital advice. But I imagine for listeners feeling maybe overwhelmed by a system that has seen such significant failures, actually putting that advice into practice.
Yeah.
That must be the most challenging part, right?
Oh, absolutely. It takes courage, persistence. It shouldn't be this hard, but that's the reality for now.
Mm. Well, this deep dive into NHS maternity services really does feel like a pivotal moment for healthcare in England. Perhaps the final thought for you, the listener, is to consider how sustained commitment, how active public engagement can help turn these vital, necessary discussions into actual lasting improvements for future generations of mothers and babies.
Well said. Thank you so much for joining us on the deep dive today. Until next time, take care.